special edition of Ask the Experts, we're talking about a problem that affects all of us here in Nevada, physician shortage. Dr. Maureen Strom of Southern Hills Hospital, she's a family medicine residency program director. She's joining us today to talk about the issue and 8 possible solutions. So thank you so much for joining us this morning.
Thank you, Nina.
Well, it's been a pleasure for us to talk about this issue. This is really important, and I guess for all of our viewers here, it really impacts us, especially when we try to schedule appointments or even find a primary care doctor.
Absolutely. Nevada ranks 49th in the country with regard to primary care physicians to the population. Overall, 47th for all physicians. And worst of all, psychiatry and general surgery rank us at the 50th.
And those numbers, really hard to hear about that. But we mentioned before the break, it does impact us in emergency rooms as well.
Yes, it does, because when there's a lack of primary care physicians, people tend to use urgent care and emergency rooms in order to get in quickly to see a physician for a problem. And oftentimes they are bringing in with them their chronic medical problems and issues that need to be addressed in a primary care setting.
Yes, and when you have an actual emergency, that obviously impacts the wait time as well.
Yes, it does.
And so why do we have this persistent problem? And this is not just a problem that we have here in Nevada.
It's not a problem just in Nevada. It is a national problem, but Nevada, I think, offers us an opportunity for demonstrated progress. Back in 2015, the American Association of Medical Colleges projected a shortfall of 20 to 40,000 physicians needed. Newer data suggests that by 2030, we will be anywhere from 50 to 120,000 physicians short. So we're really scrambling to catch up with that and look at other solutions. One solution has been medical schools have been expanding. We now have 3 medical schools in in Nevada, with another one in the process of the application to become a medical school. So that'll help in the production line, if you will.
Right.
However, when those medical students graduate, they need places to train. They need specialties to train in. And that has been another shortfall for Nevada. Just since 2016, our Sunrise Health Consortium system went from starting up 2 programs at Mountain View Hospital, including then Southern Hills Hospital in 2017. We now have a total of 10 residency programs across all specialties, 2 fellowships, and have additional residencies and fellowships in the works. So
there is still hope here, and I guess we just want to bring up the fact that if you do not really have an emergency, do not go to an emergency room. It's hard for people who do not have an option, but that is an important point.
Absolutely, and I think as an example for those solutions, our family medicine residents from Southern Hills have their continuity clinic at Nevada Health Centers, which is the largest federally qualified health center system in the state of Nevada. One of the advantages that Nevada has, if you can call it that, is that the entire state is a physician shortage area, meaning that graduates of our training programs are eligible for loan repayment and loan forgiveness, and all of the sites for Nevada Health Centers are eligible for that.
Now, thank you so much for joining us this morning. This is a really important topic that needs to be brought up, and we'll be right back after this break.